There are many people who are greatly affected by dry eyes, and I think that its impact on people's quality of life is immense, and certainly we don't seem to diagnose and treat it or even recognize it in people as much as we should.
It took many years and lots of different physicians to finally say, this isn't allergies. You have chronic dry eye syndrome. And that's when my treatment started.
The seriousness of dry eye is a pretty significant condition in the United States and around the world. And I think it's often under-recognized and certainly under-treated by a lot of eye doctors. Dry eye is a relatively complex disease to kind of both diagnose and treat, and I think we're realizing nowadays that the signs and symptoms often don't correlate. 10, 15 years ago, if they had symptoms but no signs, we basically ignored them. And nowadays we realize that even if they don't have tons of signs, if they have a lot of symptoms, that there's something underlying going on. There are many factors that can increase either the prevalence or the severity of dry eye, just starting with environmental conditions, drier environments. Air conditioning dehumidifies the air, make it cooler, which is great, but it also dries out the air and makes dry eye symptoms worse.
You can also have dry eye because you have poor tear film or too much evaporation of the tear film. And that's often associated with eyelid inflammation, blepharitis, and also can be associated with too much exposure.
It's not necessarily that they're not making tons of tears, or maybe that's just poor quality, because there's a lot of overlap between not making enough tears and kind of the oils and the lipids giving you a healthy tear film. What we really want is a nice regulated tear film. So ocular surface disease is a better term for this whole condition because it really describes more of what's going on.
I think the biggest thing dry eye is mistaken for is allergies, and everybody wants to believe allergies are the cause of, many things. And so certainly allergies can exacerbate dry eye, so it does become a complicated thing. But interestingly, allergy medications often make dry eye symptoms worse, because decongestants and antihistamines dry up our tear film some.
Other medications, some of the antidepressant medications, anti-anxiety medications can also increase dry eye, beta blockers, and things like that. Benign prostatic hypertrophy, a condition that a lot of older men get. Sometimes the treatments for that can also dry out the eyes. So that's also one of the issues these days that we may not have had as much of 5, 10, 15, 20 years ago. And certain eye surgeries can certainly increase the prevalence and incidence of dry eye. Probably the most common one these days is LASIK surgery, which certainly increases the dryness of the eyes for weeks, if not months after surgery. Often will go back to baseline, but sometimes stays a little dry.
Sometimes dry eyes can be an isolated issue, and then sometimes it's more related to a systemic problem. So especially when we're seeing patients for the first time, we're spending a good amount of time reviewing their medical history, reviewing their medications, and trying to see if there are clues there. And certainly some of the autoimmune conditions, Sjogren's is a big one, so we always ask them about dry mouth in addition to their dry eye.
If they have suspicions for rheumatoid arthritis or Sjogren's syndrome, we typically have them seen by a rheumatologist because they often need systemic treatment, which may help their eyes, but it also helps the rest of their body. There's a relatively new blood test to look for early markers of Sjogren's syndrome called the SHO test.
I have the dual diagnoses of autoimmune disorder and dry eye syndrome, and so I am zero tear production. I make no tears. My puncta are all sealed permanently. It's very hard for people to accept you and believe you when you say, I can't come today, or I can't babysit, or I can't go here or there because my eyes are so inflamed, so bad today. People don't believe you. It's really hard because it really beats you up emotionally.
So it greatly impacts patients' quality of life, and patients are very committed to trying to deal with these symptoms and trying to get better.
I think it's imperative for doctors to realize this is important for a lot of their patients, not a small minority, but a lot of their patients. They need to be able to recognize it and then offer them the appropriate treatment for dry eye disease, ocular surface disease.
Please join us for the next episode when ophthalmologists explore the current diagnostic methods used in the workup of dry eye.